Dr. Ashish Jha, the Dean of the Brown University School of Public Health. Thanks so much, Dr. Jha, for being with us today. We appreciate it.
Thank you.
First of all, the cases are declining. That is the good news, but still extremely high. Let's sort out what you attribute the declining numbers of cases to. Is it seasonal? Is it that people are using masks more? Is it that more people are being vaccinated?
Yeah, so that's the big question. The good news is there's no doubt about it. Infections are down, hospitalizations are down, and I expect death numbers to come down substantially in the few weeks ahead. That's all terrific. So what's causing it? I do think some of it is us coming off the surge of the holidays. I also think there's good evidence that people are being more assiduous with mask wearing and social distancing. And so I think those are the two. I don't know if we've seen much of a vaccine effect yet. But certainly in the next few weeks, we will start seeing the effects of all this vaccinations that we're doing on both cases and hospitalizations.
And of course, the warning is that we have to face the variants. We're not doing enough genomic sequencing to know just how much the UK variant is already here. And then we have to worry about South Africa and Brazil and other mutations, and some mutations that may be developing here as well that we're not aware of.
Yeah, and so the way for most Americans to think about this is that the big one that we should be worried about in the short to medium run, is the UK variant. That is probably best guess about 5% of the infections right now in the country, but it will become dominant around mid to later part of March. And in my mind, that's our deadline. Because by the time that happens, we could start seeing really large spikes in cases. This is why we have to be careful right now. And this is why we also have a race to get as many high-risk people vaccinated as possible by mid to late March. That really should be a target goal for all of us.
Now, do you agree with expanding the eligibility to people under 65 with pre-existing conditions, which maybe is contributing to the problems, exacerbating the problems that already existed on these websites?
Yeah, there are two sets of issues. I mean, first of all, these websites are incredibly frustrating. I have elderly parents in New Jersey who just had the hardest time navigating this. There's no reason it should be that hard. There should be wait lists. There should be a way to do this simply. Lots of companies have figured this out. States should do a better job. In terms of eligibility, obviously, it's critically important that people who are under 65 with substantial chronic disease get vaccinated. I think I'm fine with opening up eligibility if that's what states feel like they need to do. We need to get all of these high-risk people vaccinated, and we need to do it in a way that's less frustrating and less random than it is right now.
Dr. Jha, as always, thank you very much.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.